So athletes in bunion pain, we just alluded to this. Again, I told you about the weight-bearing forces on the foot, particularly when you're running, 10 to 12 times body weight in some cases. So tremendous force here, and you could just beat this joint up in ways you can't even imagine. And that a lot of athletes, a lot of runners will get what's called hallux rigidus, or arthritic bunions, based on this joint from those forces. The increasing demands of people that have push-off strength and running and pivoting sports changes your treatment. So sometimes I might err really heavily on the side of non-operative, like I said, to not change performance. But if you need to have surgery, you want to make sure you keep the working lengths of the bones all the same. You want to minimize the recovery time. You want to utilize as many soft tissue reconstructions as you can without doing too many bony changes, and you certainly want to avoid fusing any joints for athletes and high-level workers. But I put a slide on here of the old New Orleans kicker who was able to achieve his job with a foot amputation. So where there's a will, there's a way, and we can work with you and get you to your goals.